So hello everybody, we are back from the break. Here is the next category and pitching session. This is health and well-being, moderated by Sandra Fazenda Almeida from Portugal. It is a pleasure to have you here, Sandra. And we already see the 5 projects that are going to pitch, but now I want to change over and let the audience see Sandra. Beautiful.
Hello, thank you. The pleasure is mine. Hello everyone, and welcome to today's pitching session of the health and well-being category of the World Summit Awards. So as Matthias told you, my name is Sandra Almeida. I'm joining you from sunny Lisbon in Portugal, and I'll be your moderator. So just a short presentation of myself. I'm Executive Director of APDC. We are a digital business community gathering IT, telecommunications and media companies in Portugal. And I'm very excited and honored to be moderating this session today. So as you may know, we have 5 winners from the health and well-being category, and each team will have a 3 minutes time for the pitch of their project. After that 3-minute pitch, the jury members that are present will ask some questions to better understand and evaluate the projects. So I'll just give a short advice to our candidates. Please listen the questions very carefully and give a short and concrete answers. It will help our jury members to better evaluate your projects. So I have the pleasure of welcoming the following teams and projects. And I apologize in advance for any pronunciation error in the names. So we have ICOLUNG from Belgium with David, Phelcom Eyer from Brazil with Flavio, and CoronAI from China with Anuska, KAMU Asthma from Finland with Seppu, and CUREosity from Germany with Thomas. So welcome you to all, and maybe we can start, Matthias, with the first pitch. Yes. So ICOLUNG, please, David.
Thank you, Sandra. I'll be sharing my screen. All right, let me know if it's up.
Swites.
Yeah, perfect. Okay. So back in March 2020, we started seeing pictures like these in the news, and all of a sudden, well-established healthcare systems were facing their limits and struggling to handle the influx of people with COVID-19. The steep rise of COVID-19 triggered us at ICOmetrics to take action already in March. Who could have guessed what would follow afterwards? Today, we're already facing more than 123 million COVID cases, or that's the equivalent of the population of France and Italy combined. Already 2.7 million people died because of COVID, and that's about twice the amount of people that die per year from diabetes. At ICOmetrics, we did not have a cure or a vaccine, but we are good with AI and medical images. It normally takes us about 1 to 3 years to develop AI tools and get them approved for use in clinical settings, but last year we did it in 6 weeks. Not alone, but by leveraging our network of experts, academic institutions, and hospitals. We developed ICOLUNG. It's a tool using deep learning algorithms to analyze chest CT scans that helps in the diagnosis, severity, and risk assessment of COVID-19. ICOLUNG assists physicians by quantifying lung damage caused by COVID-19 and provides the diagnostic likelihood. The quantified lung involvement is associated with a patient's clinical status and can predict the clinical outcome. Physicians can thus take faster, reliable, and more informed treatment decisions, improving patient care and enabling optimal resource allocation, such as ICU beds or ventilators. ICOLUNG is a cloud-based solution, and it integrates seamlessly in clinical routine. Setting it up only takes about 15 minutes, and results are shared in a very comprehensive report for physicians. ICOmetrics is actually a brain company with an innate drive to improve patient care for people suffering from neurodegenerative disorders such as MS or Alzheimer's disease. But with ICOLUNG, we followed our heart and made ICOLUNG available free of charge for clinical use globally. Currently, already over 40,000 patient scans have been processed in over 100 centers, going from Australia to Mexico, and our ambition is to reach over 800 hospitals worldwide within the next 2 years. This is made possible thanks to the European Union and an H2020 grant we've received for the iCovid projects, which allows us to further enhance the technology of ICOLUNG and continue to offer it for free. With this great team, we hope that the efforts, no matter how small they are relative to the scale of the pandemic, that we're making a meaningful impact for patients globally.
Thank you, David, for keeping up the time allowed and for your really good presentation and for the proposed solution. So we already have a question from Connor.
Hi, David. Thanks for the pitch. I'm wondering about the 40,000 patients that have had their chest scanned through ICOLUNG and the 100 hospitals. Tell us a little bit about, have you gotten feedback from the hospitals? Specifically, I'm trying to understand, are they using your product in place of something, or did they not have anything like your product before you came along?
Very good question. And this, I mean, it varied during the pandemic in which region. I mean, depending on the number of cases they've seen, whether there was like an overwhelming situation in the hospital, then they've used it to kind of really optimize resources. In lack of, at the beginning, there were not enough PCR testing, for example, available, or it takes a day to get the results. Then in those cases, diagnosis was also made based on clinical representation and our tool. So kind of it was replacing the standard test at the beginning. Now it's more in combination. If there's like false negatives, they can actually make a judgment based on the CT output. And the advantage of our tool is it's not replacing the work for any radiologist. It's actually complementing it. It's really giving a quantitative output that otherwise typically is eyeballing. They look at like overall an estimation of how much is involved versus really getting detailed percentages, which actually gives better insights on that probability of COVID and what the future outcome is for patients. On the other side, we've seen hospitals where there was low incidence that are actually using it as a biovigilance tool almost. They're running it on every chest CT, and they've been picking up asymptomatic patients with COVID as well, because on the scan, our tool actually picked up potential signs of COVID, and then it turns out these people were positive, although they were not scanned with the idea of having COVID. So it's in multiple ways they're using it, depending on the phase of the pandemic that they are, the resources available, etc.
Thank you, Fabian. And I also make a question. How does your project stand out from the competition? Oh, but Connor, he still have another question also.
No, please go ahead. I liked your question.
Yeah.
No, it's a very good question. I think there's a couple of solutions similar to ours. I think there's a few unique things about what we've done. I mean, it was trained on not just, I mean, a limited data set, but a European data set with mixed from China. So it's very representative. And the big difference what we've done, I mean, the algorithm itself is maybe not as unique compared to others, but it's implementing it in clinical routine that makes a difference. I mean, there's a lot of algorithms, but how to make this as a product user-friendly for physicians, not disrupting workflows, making it usable, user-friendly for physicians. I mean, that's really our strength here in this project. So,
okay, thank you, Fabian. Connor, do you want to make any other question, or is it okay?
Just yeah, last point is just what happens. You know, how many times have we said after COVID? I'm sure you get this question a lot, but is the application of this analysis of this scan type, does that decline after COVID, or do you see more use cases for it once COVID cases decline?
No, a very, very true question. I mean, at the moment, the focus is really on COVID. We are already enhancing the tool to also capture the long-term consequences of COVID, meaning, I mean, this is currently assessing acute inflammation in the lungs. Long-term consequences are already popping up in as we see. So these people are suffering for a longer time. So even when the pandemic might be over, people might still be suffering from the consequences. So there's adaptations to the tool going on to also, for example, capture fibrotic lung tissue, etc. If we go into the technical details. And that then has an application in other disease areas as well. So we can kind of translate that towards further diseases. We could also look at other inflammatory lung diseases other than COVID, where this might be having a benefit. So There is definitely a future for the product in terms of further enhancement, but the tricky thing with AI algorithm is you need to be properly training it. I mean, it's typically very specific in doing one task really good, but there's transfer learning methodologies and other things, so we can kind of expand the use of it moving forward.
Okay, Fabian, thank you very much. Congratulations for being already a winner. And thank you also to our jury members for the questions. And now I would like to welcome Flavio from Brazil, from Phelcom Eyer. And we could do this speech in Portuguese, no, Flavio, for the sake of our...
Yeah, I can speak in English, or eu posso falar em português com você.
No, please stand up to do English.
No, I'm speaking for everyone.
The floor is yours.
Okay, thank you. Hello, everyone. My name is Flavio, and I am one of the founders of Phelcom Technologies, a Brazilian startup that merges knowledge in physics, electronics, and computing to create a smart device for visual health. Visual health is linked to the access head diagnostic examinations, which can identify diseases in their early stages, when blindness can still be avoided. Glaucoma, macular degeneration, diabetic retinopathy are growing. The crucial point is the lack of specialists, equipment that in many cases are not available to diagnose and treat the population. Our company's mission is to democratize access to eye exams, fighting preventable blindness. We developed this device called Eyer. Unlike traditional equipment that are large, heavy, and not connected, Eyer is a portable retinal camera that enables eye examinations anywhere. Our business model is based on device sales, but it's ready for monetization through remote medical reports in a telehealth system or hardware as a service. Our advantage is to be connected to our own cloud system, allowing telemedicine and using artificial intelligence that helps identify challenging diseases. And every day, our algorithm becomes more and more accurate. Our devices have already made a difference in the future of people who had never been examined before. We tested it in Brazil, and the result was incredible. We made an impact in social projects. We were evaluated in academic field. We were supported by prestigious institutions, but the main difference was the independent professionals that trusted in Phelcom, multiplying the impact on their patient lives. This is our amazing teams that runs an industrial facility specialized in assembling the equipment, take care of research and development of new products, runs the internal operation and commercial activities in Brazil and abroad. Phelcom was founded in 2016 and started selling 2 years ago. We already had a history to tell, what a bright, beautiful future to build. Our growth strategy is based on our technological domain, creating health solutions that are tools to help people. The Phelcom next step is addressed to production capacity increase and internationalization. And it's my pleasure to present these sections. Thank you so much.
Thank you, Flavio, for keeping up the time. It was just in time, so thank you.
I was training.
Yeah. We are not seeing yourself. Can you put your camera on, please?
Yeah, my camera was not running. Okay, no. It's here.
Yeah, perfect. Now we are seeing you. So do we have any questions from the jury? Yeah, Connor is here.
Okay.
Yeah, I guess I'm getting used to being the jury that jumps in first. Thank you very much for the presentation. I understand the product very well. I understand the impact very well. I don't understand the model of implementation. So can you walk us through who are the people buying the devices? Is it local pharmacies that then give the tests out locally? So sort of who's buying the devices and what is the distribution mechanism to get it to the people that need it?
Okay, today we are manufacturing and selling this product to everyone in Brazil. Our main customers are independent professionals that buy these products and use this product to offer exams in anywhere in their customers. But we have some another business model that is disponibilization this product in some points like drugstores or pharmacies, and we are running remote diagnosis in a telehealth system. There is a reading center that there is some specialists, and in the point where is the patient, there is some technicians. The technicians do the exams, sent to the health center. The health center reads the exams and send back it to the patient.
Okay.
We have these two models.
Okay, Fabian, thank you. It's so wonderful to see an application, a further application of the mobile capacity with health purposes. I don't know if there is any other question from our jury members. No, otherwise we are we are on time, so I will. Oh no, yeah, Odetta, please.
Yes, also thank you for a great presentation. I just wanted to ask you, what would you pick as your #1 benefit over the huge machines that are performing these scans in hospitals? So what do you think it's the core best thing about your product?
Okay, the game change here is to be connected. And when I'm connected, I'm building some big database, big images database, and it's increasing our artificial intelligence that helps to identify characteristics of some diseases. And the big difference is to have a centralized database of images that in the future will make our intelligence artificial more accurate.
Odetta, do you want to make another question or still just the hand?
Yes, if I may, just a quick one. So is your does it matter what the phone camera is, or does the phone come with the device? As in, the retina size of the camera can be completely different and the pixels and everything. So how important is that, or is it yours? It's a package.
Okay, our hardware comes with the smartphone. Here we have some lenses. Here we have some electronics, but we sell the whole product, the hardware and the software and the smartphone. No problems when we change the phone, because we change this part and we can adapt it. We can easily adapt to the new model. We are always using the best one.
Yes, but you are selling it with the mobile.
Yeah, we are selling with the mobile. Okay. Today we are using Samsung S9, S10.
Okay, Fabian, thank you very much. And I will also congratulate you for already be a winner in your team, and wishing you all the luck in the future. Thank you.
Congratulations.
Yeah.
My pleasure.
Parabéns.
Bye-bye.
Now I would like to call Anushka from CoronAI, joining us from China, maybe? The project is from China, but I don't know where is Anushka.
Yes, I'm embodying the World Summit Award spirit. I'm not in Hong Kong right now, but yes, I am representing Hong Kong today.
Yes, so please.
Yes, let me just share my screen. All right. Can you see my screen?
It's full screen. Okay.
Yes, great. So hi everyone, I'm Anushka. Today I'll be presenting on behalf of the CoronAI team, and we believe in bringing medical screening to anyone, anywhere. And so essentially what we do in a nutshell is use artificial intelligence and machine learning to monitor when the pandemic arose, the COVID-infected patients, but in general, patients all over the world with an easy-to-use machine that does not require human interaction. So let's take a look at what the problem was. When all of us students had a bit more free time on our hands because school wasn't a thing anymore or everything shifted online, we decided that we should help the doctors and nurses who are unfortunately putting their lives at risk by interacting with infected patients, of course, with PPE kits, but that only goes so far. And so we decided to come up with cheaper, faster, and more portable alternatives for medical screening. So when I say medical screening, we're talking CT scan machines, MRI machines, X-ray scanning machines, all very bulky, expensive, and not portable machinery that you only find in hospitals. So what did we create? We created the CoronAI band. This is a comfortable band that you can simply put on and use to scan whatever part of your body. Currently, we're focusing on lung scanning and using electrical impedance tomography, which is a non-invasive type of medical imaging. We're able to extract real-time images of internal organs. And so essentially with CoronAI, doctors and nurses all around the world can focus their efforts where absolutely necessary. And in the future, both you and I can have a CoronAI device at home to monitor our health at all times. So I wanted to also touch on the fact that, this technology isn't limited to just the virus. Of course, it does make a lot of sense with this remote monitoring aspect of application. However, this can also be a way to revolutionize medical screening in the future. People don't need to wait for their appointment to get a scan in the machines in the hospital, and instead can take a preliminary scan wherever they are so that their doctors can make better, more informed decisions. And I very quickly just wanted to show you a little snippet of our product. So I have a video here that we will send the link to in the chat because I don't have time to go through it. But you can see that this is essentially what our results look like. This is a person in real time who's taking deep breaths. These electrodes are housed in our band, and you can see this heat image that changes as the person breathes, which will give doctors full access to the internal organs of the body without having to put them inside any heavy machinery. And so with that, again, we hope to revolutionize medical screening and bring it to anyone, anywhere. Thank you.
Thank you, Anushka. Oh, I'm so glad that until now, all the 3 minutes were the 3 minutes limit were accomplished. So thank you very much. And thank you also for your visual presentation, clear and visual presentation. Now we'll have some questions from the jury. I don't know who wants to be the first. Connor? No, joking. Yeah, Connor. Yes. Yeah, now it's okay.
Yeah, there we go. Okay, see, so I'm wearing down in terms of questions here. Thank you, especially for showing us the product. So I didn't know that a band around the outside of the body could create an image of an internal organ. So I don't really have a question. That's just surprising to me. So thanks for demonstrating it. But you didn't talk so much about traction. Who's purchasing this? Where is it being used? How many hospitals or people are using it? Is it mostly in-home or at medical institutions?
So apart from, us being the World Summit Awards winner, we were also announced as Google Developer Challenge winners. And so we use both these platforms to leverage our technology. And essentially what we're waiting on is for the COVID situation, like you said, if we can say there is an after COVID, to get better and, for us to actually do clinical trials and focus groups in these hospitals. So we have a few doctors who are our mentors who are more than happy for us to go in with our prototype and test on actual patients, see whether it's easy for the layman person to use and, do those kind of testing. And so as of now, we're not selling and we just have prototypes ready, which you can see in the video that we shared. But very soon, we hope to be first primarily selling to hospitals around the world since, they A, have a budget to purchase these devices and B, have the direct application venue. And then in the long-term future, we hope for it to become a device that any family can purchase for medical diagnostic or, keeping up with their health.
Odetta, please.
Hi, thank you so much. And it seems like really, just as Connor, said, that you can just put something on top of your body to understand what's inside. But I I actually didn't quite get it. So you said you had a band, but then you showed the those things. I don't know how they're called. The ones that, you know, the
electrodes. Yeah,
electrodes. So are the electrodes connected to the band? Like how does where's the connection? And then, like, do you also develop the software to analyze the data, or do you tap into a software that is already analyzing the regular scans? So can you work a little bit through that process?
Definitely. So the electrodes that you saw in our demo are essentially the electrodes that we have inside the band. So if you watch the entire demo video, the person that we've demoed it on is wearing a black strip, a black band, and the electrodes are within that. But for more clarity in the video, we just put the electrodes onto the person's body, so it's clear that these are the essential data points that we're referring to. So that's to answer your first question. And for your second question, yes, all of our technology, including the software, is also proprietary and in-house. We essentially used the CDC's existing database of lung scans to feed our machine learning model and further train it. And essentially, we have an online software platform right now where one can upload a scan, and the technology will essentially give you an indication of whether or not you should take a look at seeing the doctor or you're doing okay.
Can I have another one? I just wonder, like, how come it has never been invented before? Like, you know, why has nobody ever before put a band on top of the body to do it?
I mean, from a biased perspective, I'm going to say because people were waiting for us, but jokes aside, I think the reason is truly because electrical impedance tomography technology has been here for a while, but it was just being applied in different ways. So right now, EIT is primarily being used for sign language translation or, you know, other applications of research within the ICUs. But no one really thought of using it for something as simple as medical scanning. And I think, you know, we were the first to do that, and we thought might as well use the skills that we have as, you know, engineering students to try and do that while we're juggling our studies on the side.
Yeah, Anushka, wonderful. So we already have had 3 pitches from out of 5, and this has been all the pitches are proving that this category competition is really strong. So congratulations for also being a winner. And I will ask now Seppo from KAMU Asthma from Finland to start his pitch, please.
Thank you. Just a second, I'll share my screen. Is it visible now?
Yes.
Excellent. So my name is Seppo from KAMU Health. And at KAMU, we help people with chronic conditions to stay motivated to their treatment and thus feel better. There are 350 million people living with asthma worldwide. While there is no cure for the condition, studies show that guided self-management helps to keep asthma under control, improving the patient's quality of life and also significantly reducing the cost and burden for the healthcare system. A good treatment balance also reduces the risk of severe infections, such as COVID-19. Now, guided self-management means adherence to treatment as well as regular lung function measurements. But due to contamination risk, these tests cannot be taken at the clinics for now. The pandemic will also leave millions of COVID-19 survivors in need for regular lung monitoring, as we know the disease can cause long-term damage in their lungs. To close this huge care gap, we need digital solutions and remote care. And this is where we at KAMU can offer a helping hand. Our solution includes a personal spirometer. It's a hospital-grade device, but designed for measuring lung function at home. The spirometer works together with KAMU's smartphone application that is used for tracking symptoms, use of medication, and external triggers like changes in air quality and weather. This is how KAMU makes it possible to monitor those who need it without having them come to the clinic. The spirometer is easy to use and gives feedback for the user if there is a problem in their technique. We make it easy for the user to follow their condition and predict where it's heading. Our service is designed patient first to actually help the asthmatic know what's going on in their lungs. Another important aspect is to support the collaboration between the patient and healthcare professionals. Making it seamless and based on data, brings benefits also for healthcare payers, such as employers and insurance companies. KAMU can also help research organizations and pharma industry to develop better medication and care through reliable real-world data. Our key team has extensive background in building and commercializing enterprise software, smart algorithms, and e-health, as well as medical expertise and internationally experienced advisors, not limiting to just medicine. Chronic patients and COVID-19 recoverers deserve good care and monitoring during and after the pandemic. The old ways can't answer to the new circumstances. Now, to make the situation a little easier for the asthmatics, we have made a version of our app available free of charge in 18 European countries. Now, that's all. Thank you all, and time for questions.
Thank you very much, Seppo. I was mute and kept speaking. So thank you very much for your presentation. And let's hear some questions from the jury to better understand. And it's such a pity that we can be together in person so that we can touch these devices and to get to know them. Because this year we have this kind of applications like Brazil and like Finland and the other ones with the band. So it was good that we had the opportunity, but hope to next year to be able to together. So Odette, please join us with your questions.
I wanted Connor to be the first to ask this question, but then I will be the one.
No.
Yes, thank you for showing this presentation. And can you share a little bit about the number of customers that you have and the number of asthmatic patients that you already helped? And this is totally Connor's question, but it's like measuring the impact by the number of actual customers that you have.
So as a medical device, so the software as in itself is also a regulated medical device, and now that we have a CE certification in place, we can actually commercially provide this outside of clinical trials. So majority of our customers are currently B2B customers who use the platform in gathering evidence and data in for example trials where they measure the efficacy of respiratory drugs. But we are also now heavily expanding towards this self-guided asthma treatment, and we have several hundreds of end users currently as an asthmatics outside these B2B cases as well.
Yes, Seppo. Gabriel, you have a question from Gabriel Dick. Hi, Gabriel. Yeah.
Second, yes. Hello, Seppo. How are you?
Hi.
I was in the jury, actually, in this category, and I remember that you were talking a little bit about the impact of your product on the COVID cases, but I didn't hear anything about this now.
Yeah, we're actually involved in a couple of clinical studies that look into the long form of COVID. So what happens to the patients after they are admitted from the hospital? So the research teams use KAMU's platform not only to track the lung function and reported some symptoms, but also pulse oximetry and other devices that can actually be used together with the KAMU's software. So it is for COVID recovery. It's currently actively relevant in terms of clinical use, and the intended use of it is not for sale as a end user product for COVID recovery patients. Obviously, it can be used off-label for that one as well.
Okay, another question about your business model. How are you planning to expand outside the boundaries of your country or outside the boundaries of Europe?
Yeah.
And you're planning to have a network of distributors or sell online or whatever? I mean, what is your plan?
Yeah, so we mainly sell to healthcare providers, and while doing that, we partner typically with local vendors who have existing distribution agreements with the large hospitals and clinician chains. And obviously then expanding outside of Europe is a question of not just on the business development side of, but also meeting the local regulatory requirements. So, for example, Brazil has their own set of rules, so does the US and so forth. And those need to be met before we can expand outside of Europe. That is, however, actively being worked on.
Okay, thank you, Seppo. Odette, do you want to make the last question, please?
If I may,
yes, please.
Just also, sorry, coming not from the medical background, it's sometimes difficult to understand, all the technical details that you are telling us. But I just wanted to ask, is the device your kind of main product, or is the software that is analyzing the data? And also, just from does the device capture all the information that it needs to make these difficult decisions? Because it seems that it would have to have a lot of sensors in it, right?
Yeah, great questions. The main product is really the software. The spirometer is a key data source for our analytics engine, and that is required to measure what the patients cannot report. People do not feel how the inflammation in the lung tissue is going on, and that's why we need the hardware to actually measure it. The hardware in itself is actually of the same quality as the ones that are used for diagnostic purposes. The hardware is just modified for our use case to make it simpler for end users to do the test at home, so that they detect any anomalies in the testing or any errors while performing the test.
Thank you, Seppo. Wonderful presentation, wonderful project. That's really a question that people weren't aware of the impact that COVID was making in some asymptomatic people. So it's really an interesting project, and congratulations for already being a winner of WSA. Nice to meet you. And finally, but not least, I would like to welcome Thomas from CUREosity, Germany, please.
Thank you, Sandra. I will share my screen now. So,
yes,
1 second can change a life. 20 years ago, my son, just a baby, was paralyzed in a car accident. Since then, I have been searching for effective rehabilitation all around the world. That's how I got in touch with various forms of therapy, latest neuroscience and technology. But it's not just about my family. I'm Thomas Sauer, one of the founders of CUREosity. We founded CUREosity to fill the gap between the lack of high-quality therapy and steadily increasing number of patients with cognitive and motor impairments. Today, we are a team of 30 highly motivated talents. After more than 2 years of clinical evaluation, CUREosity launched a CE certificated medical device, Cureo, in clinics. Cureo is the first and only adaptable self-learning VR therapy software using multisensory feedback with non-perceptible latency for neuroplastic recovery, accessible for everyone. 1 second can change a life. Our vision is to change patients' life globally.
Thank you, Thomas. Well, such a touching presentation. Well, let's hear some questions from our jury members. Who wants to be the first? Is there a race? Connor, you won again.
I don't know if there's a race. Maybe there's a competition to be second now. Thank you very much for the presentation. I'm curious about the adoption of the product. So are people purchasing it? If so, how many? Do you have any enterprise or institutional partnerships that are focused on distributing this? Tell us a little bit about traction and use.
Yes, we are on the market for 6 weeks, and we already sold several systems to big facilities, and we got a very, very good feedback. So the next month will show how many will follow, but our calendar is full of presentation dates, and we signed several big facilities. So we start in the big facilities, in clinics, and after this we will continue. We will continue in the aftercare market and provide our system to therapists, ergotherapists, and later we plan to go to the patient's home, because a lot of patients have been abandoned. It lacks a strategy to help patients from the early beginning of therapy just to the way home, because after neural damage, use it or lose it. If you don't practice high frequency training, it will get worse, and that's our approach to make this therapy accessible.
Yes. So you are giving hope to people that have suffered injuries, that it's a hopefully project. I don't know, Connor, you still have your hand raised? Was it from last time? Or do you
want? Yes, no, I would love to ask another one. Thank you for your answer. I'm curious as to the impact that your device has on patients. How do you measure this impact? One of the presentations earlier said out of a class of 100 students, usually 20 are engaged. With our system, 83% are engaged. That's a great demonstration of impact. How do you measure what the difference is for the patients that use your system?
Yes, first of all, we developed this system completely in cooperation with the clinics, with therapists and patients. From the beginning on, from the first prototype was already in the clinic. We collected data from hundreds of patients, and this proves that, and we make a pre-evaluation study, and this proves that even elderly patients really enjoy this training. And sorry, I got a call here. And we are involved in a study which proves the outcome of the therapy, and more studies are planned with our clients. We will prepare one study for Parkinson patients. Today, we are involved in a study for stroke patients. So we compare our solution with conventional therapy, and we have to look what the study shows. But for now, we get a very good impression that we. What I could tell you, we have a lot of documented. We achieved initial effects for patients who were abandoned, who suffers from, there is a plateau in therapy when the patient doesn't make any efforts at all. And a lot of patients show with this completely different approach new abilities.
Okay, thank you, Thomas. Last question, Odette, please. We are short in time.
Thank you, Thomas. Yes, so quickly. Again, is the hardware or the software your main thing? Because I imagine that, it's very much Oculus Rift, and then you have, things that measure performance. But then where is the key component of your program? Is it that monitoring the behavior and the movements, or is it actually the movements that people see and the software that you have developed that is encouraging this better performance or better healing than traditional ways of therapy?
First of all, it's the software and the movement principle. We developed a neuroplastic movement system based on neuroscience that we use nearby networks in the motor-sensory cortex, and we developed a low latency movement motion capturing system, and we apply our measurement to a biomechanical model. It's completely different than usual virtual reality systems because we provide a real-time and very precise of the patient. And we give by this low latency feedback, we kind of trigger the nervous system to find no connections.
Okay, Thomas, thank you very much.
Thanks.
And thank you all for attending. And I hope that we may connect in person in the near future. Stay safe and good luck for all the winners. I'm really curious about who will be the global champion, as all the projects were so first class and so good. So thank you very much.